Jai Hind, everyone. Uh, Today we are studying about border molding and posterior palatal seal. I am Dr. Akash Sharma, Assistant Professor in the Department of Prosthodontics in Subhati Dental College. Today we are discussing a very important topic in complete dentures, that is border molding and posterior palatal seal. Mostly this is a clinical aspect, and we are discussing the clinical aspect to learn it in a chair side method and as to present in the regular practice, and to how to represent as an answer to write in your question papers according to the need. So the most important thing Mahatma Gandhi has said, be the change you want to see in the world. So if you want to do good work in prosthodontics, you need to learn that you should be precise, as P from prosthodontics is the precision we need for the prosthetic work. So another P is the patience you need to learn with time. So these are the guiding forces in my life, which guided me at different places to make me a good professional person in my life. So Guru Brahma, Guru Vishnu, Guru Devo Bhava. So when we start the bottom molding, we need to learn few things about the normal parts. So as we have earlier discussed these things in our the previous lectures, that is depending on the purpose of impressions. So it can be a diagnostic impression, or it can be a primary impression, or it can be a secondary impression. Mostly in complete dentures, we precisely go for a primary impressions, while the primary impression are being taken from the primary impressions are have been taken from the stock trays that are the most commonest one, and that are just to prepare a custom tray that can be used in your secondary impression, where we perform the border molding as well as the wash impression following after the border molding. So the secondary wash impressions involves the fabrication of a custom tray, border molding, developing the posterior palatal seal area while we are taking the maxillary impressions, making the wash impression. That is, after once you have completed with the water molding, you need to proceed for a wash impressions. So, the depending upon the theories, it can be a mucostatic, mucocompressive, and selective pressure technique. Selective pressure technique can be discussed as a combination of a mucostatic technique and a mucocompressive technique. So you need to learn that we are selecting certain areas for a pressure, certain areas for pressure free. So that's why the technique has been termed as a selective pressure technique. So in the mucostatic concepts, particularly, we are discussing that mucostatic is we are recording something in a static condition. We are not applying any pressure. We are not changing anything in that. That is the mucostatic. So we have just displayed on the screen that is no pressure on the tissue. So mucocompressive is a pressure full technique. When you compress something, as like impression compound is compressing your mucosa, is the pressure technique. So we can fabricate a denture with a mucocompressive technique also, but the pressure on the alveolar ridge on the tissue will affect the further proceedings of our impression. So it will ultimately let the bone necrosis, the resorption of bone following to the looseness in denture. So it is never suggested to fabricate a denture in a mucocompressive way. Rather, we select the areas according to the primary stress bearing area and secondary stress bearing area, relief areas, and the limiting areas with the help of the border molding. So when we are talking about the selective pressure technique, it is a combination of pressure and minimal pressure technique that was given by Boucher in 1950s. So the philosophy where the certain areas of maxilla and mandible are suited to withstand the forces of mastication, and certain areas are not withstand forces due to the underlying anatomy. Actually, the answer for this, when somebody asks you why the primary stress bearing area or the primary stress bearing area, as their cortical bone, which can withstand the forces, and the rate of resorption of the cortical bone is comparative less than the normal cancellous bone. So we opt primary stress bearing area according to the need of the pressure. So the areas which can not be okay, which can be withstand the maximum forces are the best areas to withstand the forces on a denture. So the rate of resorption is quite less. As we all know, the bone resorption happens when we wear the denture. But the denture is being controlled if we opt for primarily stress bearing area, following by the secondary stress bearing area for our impressions. So that's why the role of the selective pressure technique is quite evident for the same. So, the stress bearing area of maxilla are horizontal plates of palatine bone, crest of the alveolar ridge, stress bearing area in mandibular buccal shelf area. The relief area of maxilla is incisive papilla and mid palatine raphe. Similarly, the relief area of the mandible is crest of the alveolar ridge. Just for the knowledge sake and for the AIPG exam preparation aspirants, I can say that the rate of resorption of maxilla is to mandible is 1 is to 4. So the 4 times mandible resorbs faster than the maxilla because the rate of particle bone is more in mandible rather than maxilla. So the trabecular patterns are less in mandible and in maxilla they are more. So the blood circulation is evident and the healing part is quite better in maxilla and less in mandible. So it is just one of the things which I am discussing with you people that you will acknowledge yourself that the maxilla resorbs lesser than mandible. So custom tray with spacers for ideal ridges where uniform pressures can be given in entire denture bearing tissues. It's the spacer. The function of a spacer is to provide the final impression area, which can be removed later when we are taking the final wash impression. So the custom tray is also associated with the spacers. The spacers are particularly used as a just a second. The spacers, this is the Red Morrow Roads design. These are the tissue stops. These are just to calibrate the forces from right and left side equally. So when we are taking the impressions, the tissue stops should be uniformly exposed to judge that we calibrated the force in a uniform way. So these are the different styles of spacer designs which are particularly used. So the most commonest one we used is a voucher design with tissue stops. So according to GPT, an individual impression tray made from a cast to recover a preliminary impression, it is used making a final impression is according to the GPT-9. Currently, we are having GPT-10, that is glossary of prosthodontic terms, but there is a no change in the definition of the custom trays. So, particularly, we are just continuing with the definition of GPT-9. The types are the custom tray with spacer, close fitting trays, and custom tray with window. So, the window custom trays are uh, particularly used in the Zafirullah technique, that is the window technique, particularly used in the flabby-rich tissue conditions. So, according to GPT-9, the border molding is the shaping of impression material along the border areas of an impression tray by functional or manual manipulation of the soft tissue adjacent to the borders to duplicate the contour size of the vestibule. It is the purpose for the border molding is to create the peripheral seal, that is, peripheral seal by the maxillary and mandibular border molding is evident to get the retention part. Whenever we are talking about the border molding of maxilla and mandible, the maxilla, we are particularly more emphasis on the retention part compared to the stability, while in case of mandible, we are quite emphasize on the stability part than the retention part. So the border molding can also be termed as a what should I say? It's a peripheral tracing or muscle trimming or border molding termed in such a ways because we are peripherally limiting the structures. Muscle trimming is we are moving the muscles in a certain mode that we attain a neutral area where the denture can be resides easily. So steps for bottom molding is the incremental or sectional bottom moldings. In this method, the section of the peripheries of the tray are refined individually according to the anatomical landmark in that area. So the incremental technique is we are incrementing the material in a small areas, and we are recording the areas and merge it area by area and completing the sectional forms. So normally the bottom molding can be done with the help of the greenistic compounds. Normally at the undergraduate level, we do it in a certain way. But when you have an idea of your refinement part, your muscle trimming area part, you can very easily use a polyether material or a single step bottom molding. So when you get advanced or you get pro in your methods, then you can easily go for the bottom molding in a single step thing. So the single step bottom molding can also be done a part of a sectional impression tray. So the most commonest movement for maxilla and mandible is upward, outward, and downward. So the lip should be elevated and extended outward, downward, and inward. Then the cheeks elevated and extended downward, sorry, outward, downward, and inward. The buccal frenum by pulling the cheek backward and forward. So the frenums, it should be you need to free the frenum first, and then you have to perform the movements according to the need. So the distobuccal region, particularly the cheek outward, downward, and inward, followed by the opening of the side and moving the mandible from side to side. So when we are asking side to side movement of mandible, how mandible is affecting the side to side movement of mandible affecting the maxillary impression, as our distobuccal region is very much in close proximity of the coronoid process of mandible. So when you perform a side to side movement of a coronoid process of mandible, it will slice your material and it will attain a neutral area for the tension. So the posterior part of palate, the patient should be say aha while refining the posterior borders. It can normally termed as a Valseva manure technique, which particularly be used for the recording of PPS. As during the childhood time, everyone develops the suckling reflex first. The sucking can also be done, or sucking of the finger can also be done by the patient to generate the reflex and the palatal muscles to activate and to get recorded in the impressions. So along with AHA, we can use the suckling reflex. So you can use one by one. If you are not able to get your impression by AHA also a manure, then you can opt for a suckling reflex particularly, but you need to focus the tilt of the head for PPS record is very much important. So this is just a question from my side that you should go through the books for the same, and you'll get the add-on literature which maybe I missed in my this lecture. So you can just find it out the head position. And if you have still you have any doubts, you can come in contact to me and by any way, and I'll give the answer for the same. So the head position is quite evident in this, and you can get the palatal muscles activated. The thing is, so the most important part in the impression is the posterior palatal seal area. Generally, it is a area between the anterior vibrating line and the posterior vibrating line, which is imaginary lines. So the cupid shape of the PPS is the cupid is because of the bow shape of the cupid is the anterior vibrating line, and the posterior flat one is the posterior vibrating line. So the area in between those is the PPS area. So PPS can be divided into two parts, that is a pterygomaxillary seal and palatal seal. So normally the PPS is of two types, three types. It is the bow shape, the line shape, and the butterfly shape. So they are the most commonest question in your Viva, which can be easily answered by having knowledge about the shape. So the labial portion of moving the lip upward and inward in case of mandible. So the mandible is a bit cumbersome according to me in comparison to the maxilla, because we have a tongue, we have a saliva, which particularly not helping us to get molded the mandibular impression. So you have a precise knowledge about the same, that the anatomy of the mandible requires a confident image in your mind to get the clear impression. So before, as we have all heard, being in a prosthetic parts, before meet the mind of the mouth of the patient, you should meet the mind of the patient. And we never take the impression, we always make the impression. So you need to make impression in your hand and get it verified from the patient's mouth. So that is the most important thought you should keep on running in your mind. So if you ask me as a prosthodontist, I always feel easy for maxillary impressions and difficult for mandibular impressions. So it's just an advice to you people that whenever you are taking the mandibular impressions, so you should keep the anatomical part in your mind so you can answer in a very fine and precise way. Okay, so the labial portion should be performed in such a way that the lip should be moved outward, upward, and inward. That will help into record the mentalis and orbicularis oris muscle. So buccal frenum, for buccal frenum, we should move the cheek outward, upward, backward, and forward. That is to record the vexillary. The cheek will well retracted and move upward and inward. The most commonest movement, the like whistling and pouting, are the most commonest physiological performance you can be done by the patient to verify those things. So anterior lingual border can be done by protrusion of the tongue, that is activation of mylohyoid muscles. Distal end of lingual flange is superior constrictor while protruding the tongue. Pterygoid, that is the medial type, by asking the patient to close against the resistance. Against the resistances, you are keeping both fingers, your index finger and middle finger of your right hand in the patient mouth, and you ask the patient to close the mouth. And the patient is going against your forces because you are pushing your four fingers downward, and the patient is about to close the mouth. So that is the easiest thing you can do to record the medial pterygoid against the resistance. So what you need to do is whenever you are taking the mandible impression, you need to record the things in a very fine way and keep it in a such a way that it will be easy for you to record the same. Okay, so when the mandible impressions are recorded, you need to be very much patient because the borders of alveolingual sulcus can affect or get changed when you come in contact accidentally by a tongue. So while taking the impression, you should be cautious that whenever or whatever area is heated or about to get modified, you need to avoid those to get in contact with the tissue other than you want to get it recorded. Okay, so that is the most important thing. You should be in contact that part. So there is also a LTF area, that is the lateral throat form area, which you need to focus. So LTF is having three classes: class one, class two, and class three. So when you have want good stability in your mandibular denture, you should be precise on that part, that LTF class one should be attained if the patient is of such type, because it will provide a very good retention in your denture. Okay, so whenever you are as the class progresses, the prognosis of the mandibular denture get poor. So you should be precise and focused on that part, that the things are quite efficient on that part, that you should record the lateral throat form area for the mandibular dentures. So if you are always trying to be normal, you will never know how amazing you can be. Okay, so it was given by Maya Angelou. So being amazing is always good, but it's not like that without performing, without your giving a best or without performing well, you can be amazing. So the precise thing about the amazing is that amazing part is very much precise related to your best of your thought. Okay. So, as we have already discussed about the single step border molding, which can be done with the putty materials, that is the particularly the polyether type of the condensation silicons, it is quite important that we should when you are being pro with time, you know the borders, you know the anatomy, then you can go easily for the